Hi, this is Michelle Kobayashi and I work with National Research Center. Today I'm going to talk about the 10 things you need to know about preparing your community for the older adult population. Welcome to the Local Government Top 10. There's a lot of talk these days about how to prepare our communities for older adults. As local government, it's been an issue some of us have been involved in and some of us not so much. But we're realizing that it's an issue we all have to address and think about how to prepare our communities. The discussion for today, I'm talking about the aging trends in America, talking about common community challenges we found through the data that we collect, and also some things to consider as local governments work on these issues. So the number one of the top 10 is our communities are forever changed. The U.S. Census is showing that the proportion of our population that's older adults is going to increase rapidly over the next years. In 2013, about 1 in 7 of our residents were older adults, but by the year 2040, about 1 1/4 of our residents will be older adults. And I know this percentage varies in communities. There's some communities right now that have at least half their residents as older adults. So we know that's happening. The other thing we know about our communities being forever changed is not only are there going to be a lot more older adults, those older adults may not be the same kind of older adults we typically associate with seniors. It's the baby boomers. They are the elephant in the python moving up through the age trends of life. And basically, what we know about the baby boomers is they change everything they touch. They made youth look different. They made adulthood and parenthood look different. We know they're going to make retirement and older adulthood look different. So besides the fact that there'll be a lot of them, we're going to see a different kind of older adult. We've often seen older adults kind of more the frail fringe, those at the end of their life, people needing congregate meals, transportation, folks, being closed in their houses, going to nursing homes. But we need to start thinking about older adulthood as a long period of your life with a lot of active older adults who can really contribute, and they can really be assets to the community. So they're not just folks who are going to take services, they're actually residents who can really help contribute to the community. So really, our communities are going to be different, and just different not because we have seniors, but because we have different types of seniors. What do you think are the biggest challenges for older adults in your community? I'll tell you a little bit about where we get our data. We actually do older adult needs assessments in communities across the nation where older residents, either age 55, 60, or 65, tell us how they feel about their communities as a place to retire, as a place to live. They tell us about community amenities. We also ask them what kinds of problems they've experienced in the last 12 months. So we have percentages of older adults in various communities, and we can find out which problems they struggle with the most. We also do another survey called the National Citizen Survey, where we ask residents to rate their communities and their governments, and we actually pull all the older adults from that data source as well to find the data that we are talking about today. So the topics that are covered in the older adult needs assessment is overall community quality, where we ask them about the community as a place to live, if they plan to keep living there. We ask them about community and belonging, sense of community, overall sense of safety. We ask them about the community information. Do they have the information they need about older adults? Do they have the financial and legal information to stay independent? We ask them about productive activities, civic engagement, social engagement, recreation, caregiving, and their economic contributions. We ask them about the health and wellness opportunities in the community and how they're doing in terms of their health and wellness. And then we also ask about community design and land use, housing, mobility, access to things they need to age in place. The database we have of older adults include over 300,000 older adults and many, many communities you can see on this map where our data come from. So we're talking about a lot of data that's been based on probability samples. So it's a representative sample of older adults across America. Our number 2 finding of the top 10 things you need to know is that older residents like where they live. If you ask them to rate their community as a place to live, about 86% or 9 in 10 say the place they live is excellent or good. About 70% say their community is a great place to retire. But about 60% say the services to older adults in their communities are excellent or good. We also asked them if they'd recommend others to come to their community and live, and about 86% say they would. And about 85% say they plan on remaining in the community that they live in now. So the older adults tend to like where they live, and they actually plan on staying. So as local government service providers, you need to think about what that means. We're a society that's data rich and information poor, and it's the same with older adults. What we find from a lot of the surveys we do is that a big issue for older adults is having enough information about what's available in their community. When we ask older adults about the availability of information on resources for older adults, only about 5 in 10 would rate that as excellent or good in their community. And about 57% said not knowing what information is available in their community has been a problem for them. And about 40% saying they wish they had more information about public programs such as Medicaid, Medicare, and types of services they're actually eligible for. So these are types of things that the local government may want to think about, ways to provide information to residents so they can learn to help themselves. A lot of older adults experience too much time with too little to do. So we asked folks to rate their communities in terms of the types of opportunities they have for spending productive time. And what we find is communities rate the highest in terms of religious, spiritual opportunities. About 83% say their communities are great at that. About 80% say their communities have good volunteer opportunities. About 68% say their communities are excellent or good having meetings about the community. About 66% say the recreation's excellent or good. About 65% say social opportunities are good. And about 59% say the enrichment classes are excellent or good in their communities. So generally overall, a majority are saying there's a lot of things to do, but you'll see lower responses in terms of social and kind of enrichment classes. Again, when we ask them how much a certain type of productive activity has been in the past, we find that about 40% or 4 in 10 of older adults say there's not enough social activities and events for them. Again, 4 in 10 say there's not enough interesting recreation or cultural activities. And again, about 4 in 10 say they have problems being bored. So, as the local government, again, trying to find productive activities for older adults might be something you want to start thinking about. Call for the Encore. When we first envisioned retirement, people were living 10 years, 15 years after they retired. Well, we now know some folks that are retiring at 55 and 60 might be living 30 years, 40 years. So we're finding that folks they're not really ready to retire and sit in their house in a chair or on their front porch. They actually want to keep doing, giving to the community, working, and often they want to maybe have an encore career. So we think communities need to start preparing for that. At the same time, we also know that the baby boomers and future generations probably don't have the same kind of pensions that some of the silent generation and older adult groups had in the past. From the data, we find that about 40% of the older residents surveyed say they actually have issues finding work in retirement. We found about 40% say they need help in financial planning. About 1/3 say they don't have enough money to make ends meet. And about 1/3 say they want to build skills for work and they have problems paying property taxes. Trying to find older adults options, provide classes, provide work with employers, ways to keep these older adults employed, give them encore careers, and also keep them financially stable so they can age in place. Something for you to consider. We know the baby boomers care a lot about their health and their wellness. And we also know people are retiring early and are going to live a long life, so they have to kind of take care of themselves. What we find from our surveys is that about 2/3 of older adults say their overall physical health is excellent or good, which is actually not a bad number. We actually see that number decline significantly once people age past 85. But those 55 to 85-year-olds, they're actually pretty healthy and would rate themselves very highly in terms of fitness. When we ask folks about the biggest problems they've had in the past 12 months related to physical health, we find that about 6 in 10 say they've had problems with their physical health, though. And about 50% say they have problems staying fit. About 40% report that they have a hard time having a healthy diet. And about 1/3 talk about depression, confusion, memory issues, and dealing with bereavement. And then finally, we have about 30% saying falls have been a problem. And a lot of communities focus on falls because it's been found to be a sentinel event in that once an older adult takes a fall, often the next months can be very hard and then actually could be a path to a slippery slope to poor health and often sometimes even death. So a lot of communities are doing a lot in terms of fall prevention. We talk a lot about trying to keep folks in the communities they live in and also even in the dwellings that they live in, because we know nursing homes can cost a lot of money, particularly if the public's paying for that. It's something the government is interested in stopping. They would like people to be able to age where they want to, in the comfort of their own homes and with their family and friends around them. So we ask older adults about their communities in terms of being able to age in place. And so we find that about 50% of older adults say that the variety of housing that serves older adults is excellent or good in their community. So about half still having problems with the kinds of housing that's existing in our current communities. And about 40% saying that the housing is affordable in their communities. About 50% say the daytime care options are good. About 45% saying the long-term care options are good. Again, as local government workers thinking about housing and universal design and the type of housing that's probably going to change and is changing for older adult needs. Also, again, asking folks what problems they've had in the past year, we find that over half say they had problems doing heavy housework. About 40% had problems maintaining their yard. 40% had problems maintaining their home, and about 30% had problems with their activities of daily living. But again, this suggests the kinds of things local governments can do to keep people in their homes. Maybe they're able to take care of themselves most of the times, but maybe someone may need to mow their lawn. Maybe someone may need to help scrape the ice off the streets or come do heavy housework. But beyond that, they may not need to be in a nursing home or somewhere where they're in assisted living. They just need some help with some of the heavier, more physically grueling types of tasks. Caregiving is a huge issue in America right now because we find that actually a lot of the medical care provided for older adults comes from family members and friends and neighbors. And we know that this is going to get greater and greater because a lot of people cannot afford and do not want to move to nursing homes and assisted living facilities, but yet they can't take care of themselves fully all the time. In our surveys, we found that about 26% of older adults feel emotionally burdened by caregiving, about 22% feel physically burdened, and about 20% are financially burdened. Now this is of older adults, so we're talking about at least a quarter of folks have caregiving as an issue for them. Well, what else this doesn't measure is all the people who are not older adults who are doing caregiving. So for instance, folks my age, who I'm actually caring for my 11-year-old son, and I'm also caring for my 80-year-old father at the same time. So you have all these folks that are kind of sandwiched between caregiving needs. And I think communities will have to start thinking about how they can support caregivers. And maybe something working with a lot of employers, because the employers, it will be an impact on their work performance of having a lot of their employees that have caregiving responsibilities and learning how to do flexible work schedules and programs that help them support for older adults in their communities so that they don't have to turn for public assistance. About 3 in 10 of our older adults indicated they have problems with safe, affordable travel. About 76% though said it's pretty easy in their communities to get to where they want to be. 64% said the ease of walking in their community is pretty good. Ease of car travel, 63% said excellent or good. Transit levels at 37%, however, not all communities have the density to have transit. But we do know that mobility will be an issue for older adults. We know that as people age, their reliance on the single occupancy vehicle should probably be lessened. But the good news is it's not just older adults that want help with mobility. There's a lot of reasons why mobility is important. Teenagers need mobility options. People who care about the air quality, folks who care about fitness. So physical activity and new forms of active transportation are important to a wide range of people. But when you're doing that kind of planning, I think it's really important for you to consider that older adults. This will really help them to help identify ways to get folks where they need to go without having a single occupancy vehicle be involved. The good thing is you're not alone, because as older adults increase in prevalence in our communities and possibly more services may be needed, we also know that government can't do it alone. We can't even provide for the older adults that we have now. So I think we need to start looking to other partners in our community to help us deal with this. I mean, we have the government. We have other community-based organizations. So we have a lot of nonprofits, faith-based organizations who can really help us work together to make communities livable for older adults. We have the private sector. They will be caring more and more as the older adults come into their workforce, as the older adults affect the current employees, and also the private sector figuring out ways to market and engage older adults into their products. And then finally, we have our residents. One of the best things we've always had is, especially in days of old, is neighbors taking care of neighbors. And we're going to have to rely more on that. So more people are going to have to start, stepping up and joining together to help take care of the older adults in our community. So again, we need to band together, and it needs to be more the role of the local government, maybe not providing services, but being a facilitator, being the head of the collaboration, being the head of the communication, but doing things to network folks so that they can serve the older adults better in the community. Thanks for watching. I hope the information has been useful, and I hope it helps you to prepare your community for the older residents who will soon be here.